So what about ABPA, Allergic Bronchopulmonary Aspergillosis? Here the patients will have either history of cystic fibrosis or they will have history of bronchial asthma. Some history will be there. Usually this is a background predisposing condition for allergic bronchopulmonary aspergillosis. Clinically, these patients are going to present with productive cough. Productive cough because they will have background bronchiectasis and they will have hemoptysis at times. Sometimes they can have hemoptysis. So usually productive cough will be the classic presentation. And examiners might give worsening of bronchial asthma also. So another standard clue examiners tend to give is worsening of bronchial asthma. The bronchial asthma will keep worsening over a period of time. It won't respond to standard medications. So, and these patients, I mean, if you ask me, so majority of these patients will have a strong, it's a type 1 hypersensitivity. Type 1, why this is happening. So it's basically what? A type 1 hypersensitivity reaction. It's a type 1 hypersensitivity reaction. So there will be very high levels of Ig and there will be extremely high levels of eosinophils as well. So Ig levels will be generally more than 1000 and eosinophils generally will be more than 300 to 500. So but Ig levels increase is a very, very important point. Ig level is going to be very, very high, more than 1000. And eosinophils also will be high because it's a classic example of a type 1 hypersensitivity reaction. And because of that only patients can develop worsening asthma also. It's in fact one of the examples of a asthma plus syndrome, isn't it? In fact, it's an example of what? Asthma plus syndrome. Asthma plus syndrome. Asthma plus syndrome. And imaging wise, what you will see? You will see mucus plugs and bronchiectasis. That's what you're going to see. You will see lots and lots of mucus plugging and you will see bronchiectasis. And you all know this bronchiectasis in ABPA is going to be central, proximal and upper lobe predominant. We discussed that cystic fibrosis and ABPA are two conditions which produces typical central, proximal and upper lobe predominant bronchiectasis. Otherwise, most of the bronchiectasis will be lower lobe predominant. That's why this point is also important. So you can see there is a lot of mucus plugging in the right upper lobe bronchus in this example. And this is what we refer to as the finger in glove appearance. That's called what? Finger in glove appearance or finger in glove sign. So that is nothing but the mucus plugs impacting the bronchus. In this case is the right upper lobe bronchus. You can see that. So that's because of mucus plugs. And other investigations, remember, proving the hypersensitivity is very, very important. So we have to do skin prick test that's specific for aspergillus. The aspergillus specific skin prick test will be positive and we have to do aspergillus specific immunoglobulin. Aspergillus specific immunoglobulin, either IgE or IgG, it will be positive, but aspergillus specific